Joining me from Oxford, United Kingdom, to discuss this is a public health and infectious diseases scientist, Dr. Adewumi Akingbola. Thanks so much for joining us on board now. With the WHO chief visiting Kigali as Rwanda takes critical steps to curb the Marburg outbreak, it raises question about the effectiveness of international health coordination. How significant would you say the WHO's role has been in guiding Rwanda's outbreak response?
Do you want me to go first?
Dr. Adewumi, did you hear the question? Dr. Adewumi, I was asking how you think the WHO's role being in guiding Rwanda's outbreak response. How do you think, how significant do you consider it?
Ibrahim, can you hear me?
Yes, very well. Carry on.
Okay, good. Yeah, so I think that the World Health Organization's role will be quite significant because this is not going to be the first Marburg virus outbreak, and as a matter of fact, it's not going to be the first viral hemorrhagic fever outbreak in the world. I mean, this is the 11th Marburg virus outbreak in the world, and so I'm sure that the World Health Organization has tremendous experience and capacity in managing the outbreak, and because there's a structured outline to follow when managing outbreaks. So I think I think the World Health Organization's role would be very significant, especially helping to augment the healthcare system of Rwanda in optimizing contact tracing and even treating already confirmed cases.
Interesting. So the Marburg virus is often compared to Ebola due to its high fatality rate and the need for rapid containment. Could you give us an overview of Rwanda's journey since the outbreak was declared?
Yeah, so I think a very good overview would be the fact that there's been increasing number of cases. There's been increasing confirmed cases, which are about 62 as at 17th of October. And out of the 62, I think 15 people have died, which brings the case fatality rate to about 22%, which actually is still relatively fair compared to previous case fatality rates, which was, I think the last outbreak case fatality rate was 61.9%, right? So I think the current outbreak case fatality rate is still a little bit fair. So, however, it is important to note that most of the people that have been infected and most of the people that have died are actually health workers that come in contact with the confirmed cases and even the suspected cases. And also, I think as at 11th of October this year, about 800 people are undergoing contact tracing and are also continuously monitored for any sign or symptoms of the viral hemorrhagic fever, of the viral hemorrhagic fever disease, which is the Marburg virus. So yeah, so I think Rwanda's efforts are currently quite optimal, and although there's always a lot more to do to ramp up the situation, but currently their efforts are optimal in identifying suspected cases in the contact tracing, and I think also in the supportive treatment of already confirmed cases.
Even with strong public health responses, outbreak like Marburg, pose significant challenges. What are some kind of hurdles do you think one can face, looking at this outbreak, and how do you think it can be overcome, especially in ensuring that there is public communication as against having it to be transmitted or to be for other people, how contagious it actually is. It actually is for others, by taking it from that country and spreading across the African continent.
Yeah, so it's a viral hemorrhagic fever, and so it's so for the classes of viral hemorrhagic fevers, for most of them, their route of transmission is often when one comes in contact with the body fluid, most especially blood, right? So which makes it quite contagious. But thankfully, Marburg virus itself is not as contagious as Ebola virus itself, right? So so if we are to grade the transmission or the rate of spread of the virus across borders to other regions, I think it's generally going to be low for now, right? But also this also depends on the efficiency of cross-border control, right? Because if there's ongoing, continuous, unrestricted trade activities between Rwanda and its neighboring countries, especially countries like Uganda and Tanzania that have previously had outbreak cases of Marburg fever virus, I think it increases the risk of cross-border spread, right? So I think at this point in time, I would expect the public health response in Rwanda to include restriction of cross-border activities and trade, right? Just to reduce the risk of the disease spreading to its
right. Very quickly, because of our time, Dr. Adeomi, we know that controlling an outbreak like Marburg depends heavily on public cooperation. How do you think it can be managed, or one can manage to build and maintain community trust during this time? And what role do you think local health workers and volunteers can play in ensuring that critical information and preventive measures reach every corner of not just Rwanda, but across the continent?
Yeah, so since the cornerstone of managing outbreaks is by detecting them early, and for outbreaks like Marburg virus, you need to actually isolate and quarantine people, isolate the confirmed cases and quarantine the exposed cases, right? So I think there needs to be a galvanization of not just the health workers, but also I think other paramedical volunteers to ensure that, first of all, the proper information is disseminated. Because since Rwanda is also a typical African country where false news can spread faster than the actual true news, right? So there needs to be proper dissemination of the right information about Marburg fever, about Marburg disease, especially its routes of transmission and its symptoms. And also, the information must include the fact that if anyone has been exposed, or if anyone is presenting with certain symptoms, the person must also make efforts to present themselves to the appropriate contacts.
Talking about this Marburg virus, public health and infectious disease scientist, Dr. Adeomi Akingbola, thank you so much for your insight. Thank you.